Let us talk about suicide. Let us talk about suicide. Raising awareness and supporting people. Suicide Prevention Gatekeeper Training Program. Let us together create a safety net for those who is needed. When we think someone may be suicidal, it is very important listen with empathy, compassion, and without judgment. And without judgment. Today's session will gives Today's session gives an idea how to start a conversation and respond when a person says that they are considering suicide. The main aim is here to connect a person with a thought of suicide. Connect the Sorry, someone is interrupting me. Okay, please mute. Please, all of you mute your microphones. Okay. The main aim is connect a person with a thought of suicidal to others' help. How we are going to respond here? Okay, how we will respond here? The main thing is what people need at this point. The main thing that people is to be heard and not judged. The most effective intervention what we can do here is listen with empathy, compassion, and non-judgmental. We should be a non-judgmental person. The main key ingredient is active listening, few genuine words of a concern and understanding. It creates a big difference and major impact. Okay. Now, what should we do while listening? While listening, we should be active listening. Active listening, we should stay calm and be a non-judgmental person. Acknowledge the feeling of others. Give respect. Give respect. Okay. Give respect. While before starting a conversation, we should keep in the mind that that person is needed. Okay. How to start a conversation? Before that, I would like to note that here we cannot take away all the pain of the person or solve all the problems, but you can care. There is no magical words. Be yourself. If you're really concerned, your voice and manners will show it. Be patient, stay calm, and accept the person. The main the main communication you can do is communicate your concern for the well-being or by offering listening. By listening, you can communicate you can show your concerns regarding to the person. Accept the feeling of the person, no matter how irrational they might appear to you. Ask with respect, give them respect and dignity. How to start a conversation? How to start a conversation? Like we should start a conversation. I noticed you are going to in some rough phase. Sounds like you are upset. May I know what it causes? I used to see you recently. I used to see you previously. Recently, I noticed that something might be upsetting you. Asking directly questions and clearly. Like, are you feeling so bad that you're considering suicide? Do you have a plan to end your life? Are you planning to kill yourself? These questions should be directly and clearly. Other ways you can ask about suicide is, has all the pain you are going through made you think about hurting yourself? Have you ever felt like just throwing it all away? I've seen what you're doing, how much you must be hurting. I'm concerned about it. I'm concerned about you. I want to talk. I want to hear what you are going through you. These words are very empathy. It shows empathy and compassion. Like I'm repeating you, ask the person, I see you what you are doing and how much it might be hurting to you. I'm concerned about you. Concern means it's empathy. I want to talk to you and I want to hear what you are going through with going on with you. These are empathy and compassion. This is a response we should give the person, we should ask the person. It builds a good, very good rapport, and the person will, before that, we should create a trust. We should, these words can create a trust. So he can open his mouth and tell what he wanted, what he's going through. What if a person says doesn't want to commit suicide? Let us. What if they say no? If a person says that they're not thinking of suicide, accept the response. We should not interrupt them like, no, no, no. You did these things, and why you're telling that I'm not thinking about suicide? Accept a response. This is we should respect. We should give respect. That means you are showing ready, willing to engage the conversation, a serious conversation. Like willing, how can you? Could you tell, like, this can create an interest and they will develop a good rapport. They think, oh, these people are showing concern to us. Okay, I'm going to tell you like that. When a person says no, usually, if they say no, I don't want to do that, and they will explain why not. Okay, that means they did not really mean it to it come across it. Sometimes people take decisions in a short temper manner to threaten someone. Okay, like college students, they threaten they threaten their parents. If you don't buy me an iPhone, I will commit suicide. If you don't get me a new bike, I will commit suicide. They sometimes they will send, but that really doesn't mean it. Next one, they have thought about it but would never act on it. This is based on their parents and everything. They had thought in their mind, but they won't never act on it. Example, if a woman is facing a domestic violence, she thought about their kids, how they will live. Maybe she had him, this suicide, maybe it's in her mind, but she won't, I never act on it until it became very serious. And they have many reasons to live. Sometimes some people they think about suicide but they won't commit, and they have so many reasons. Like I told you, domestic violence, women think about their children, or men, like they had so many financial issues. It did not only this, right, they have so many ways to reason to live. Okay, what if the person says yes? If someone say yes, I want to commit suicide, what we should do? If a person says that they are thinking about suicide, then follow these steps. First, take them seriously. Let them know you feel that important to talk. If someone says, I had a suicidal tendency, take them seriously. Okay, don't say, hey, don't go, come on, man, chill, don't do like this. Should not that silly. Okay, don't be sarcastic. Okay, take them seriously. Let them know you feel it's important. Come on, dear. Let us talk about it, and we will sort it about. Let us like that. Next, listen with judgment, without judgment, and give them a complete attention. We should listen without judgment. What if a person judge you? Majority, all of us hesitate to talk about to some other regarding their issues, everything. Why? All of hesitate to judgment. Someone, hey, she's doing like this, she's not doing like this, he's doing like this judgment. We should never judge anyone until, see, if we go through what they are going through, we get to know what they're facing. It might be every problem may be smaller to you, your problem is bigger to you, but their problem is smaller to you. Listen without any judgment, feel with empathy. Okay, acknowledge their thoughts and feelings with compassion. Fourth one, the goal is to keep other person. The main motto of the suicidal prevention gatekeeper is the goal is to keep other persons safe who had suicidal tendency. Now, it is not a time to solve all the problems, but we can genuinely care, right? But consider the risk. If a person says that they are thinking of suicide, you need to consider risk. Ask them how often you are thinking about this. How many times you are thinking about this? When you are thinking about this, do you have a plan? Like this, so many people will try. They had different suicidal mood. Some with poison, some with hanging, some other things. Do you have any plans? Have you thought about it? How would you kill yourself? These questions we should ask them in polite manner, not in a harsh manner, so that we get to know how the person, how many times he tried, or how, in which way he is thinking to commit suicide, or what plans he had, and have you thought about when. Sometimes people will thought up in weak moment, like some stress, like some in persons they feel very low. During that time they will think about commit suicide. Example, if a student is having public exam, maybe he's not presenting well, that is a situation for him. So have you thought about when, why, where? It's very important. And what plan do you have? These are the should consider the risk. Please don't neglect anyone if they say about this. Okay. And the main thing is how to respond with empathy and compassion. Please look at the slide. How empathies look like. They just how it's like caring. First picture is someone is touching the other person with caring. Okay, um, arm around the shoulders. Next, what is empathy? Empathy is ability to see things from others' perspective and feel their emotions. Empathy is ability to see things from other perspective and feel their emotions. Putting yourself in other person's shoe lead to act of compassion. When we put ourselves in some other's shoes, it might lead to act of compassion. Empathy includes few things: the practice of sharing other personal feelings, express care, asking questions, attending, acknowledging emotion, paraphrasing their confession. That means if a person comes to you and he's sharing their point of view, or they're sharing views about regarding them, at the end of the session you should paraphrase the confession like that. Oh, you talk about this, you like that. We should paraphrase their confession. And supportive statements is I care, I feel you, like empathy and compassion. Okay. Now, what is compassion? Compassion is feeling of someone what the person is feeling. In empathy, we are abilities to see things from others' perspective. In compassion, feeling is there. Okay, feeling, holding, accepting, and take some other kind of action. That desire to help you. I can understand your distress and I want to help you. Here it's an action word. Compassion is an action word. Here we're taking an action, just not by simply seeing and from others' perspective. Here we are taking action word. Here we can define, here is empathy and compassion defining points. Feeling of someone, I understand what you're going through, I've been there. Compassion, defining aspect means feeling of someone, I desire to help you, I can understand your distress and I want to help you. Here is an action word. Now let us know about the what is sympathy, empathy, and versus compassion. Here, how pity looks. I feel sorry for you. Example, if an accident, I posted news story on you, but I post the news story about your accident on Facebook, like WhatsApp status, everything. People will generally feel pity. There is a lot of difference between these things. Sympathy. I care about your suffering. Generally, people will show sympathy. No, we are all human. We all deserve empathy, not sympathy. Sympathy works for a few minutes or few seconds, a few things, but sympathy won't work at all. Here, empathy. I try to understand your suffering. Everyone feel loved, while sympathy and compassion. We're all humans. We all need empathy and compassion in any relation, any sort of relationship it might be. Example, here empathy had again three components: cognitive empathy, affective empathy, and somatic empathy. I will explain it next slide. And compassion. Here, as we told, it's an action word. I relieve your suffering. Example, I reach out of to you and offer a concrete help. It's an action word. Compassion is an action word. Now you get to know idea about what is a pity and what is sympathy and what's empathy and compassion. In next slide, what are the different components of empathy? They are three major components of empathy: affective empathy, somatic empathy, and cognitive empathy. The name affective empathy reveals itself the ability to respond other people's emotions. Affective, respond to other people's emotions appropriately. Somatic empathy, here we can feel the pain of the person, the ability to feel what other person is feeling. Example, someone loss is there. Affective empathy means respond to the people emotions. If someone is expired something, here we can respond people emotions. Here, oh, I sorry for your loss, like that. Somatic, I can feel how it would be like that. Cognitive, the ability to understand someone response. Cognitive is thinking, here ability to understand someone response to this situation. Why empathy and compassion is very important? It try to understand others. You make them feel heard and you make them feel unheard. It deepens every relationship. It's any sort of relationship. Empathy and compassion deepen your relationship and promote the feeling of connection from all the your desire. It connect the people and feel. Feel is very important. Having a social support network tend to increase a person have. If your person is having good social support network system, it automatically increase person's happiness. If someone is there to listen you, it might be office, your career, workplace, anywhere. It created great bond and social support, increase a person happiness. They can easily tell, oh, buddy, this is going through, I'm going through like this. Without judgment, be a non-judgmental person, half of the problem gets solved. If we had good social support system, building a more satisfying life. All at the end of the day, all we need is a more satisfying. It might be come with uh, money or a peaceful everything, but the main thing is satisfying life is very important. Motivate pro-social behavior, good decision making. By empathy and compassion make us as a good taking a good decision making, reduce the burnout, frictions, everything, and conflicts. It helps reduce burnout, friction, and conflicts. All we want to with this empathy and compassion, we will reduce all the negative side effects. Low empathy. In certain people, developmental and psychological personality disorders, by they had very low empathy and compassion. Borderline personality disorders, narcissistic personality disorders, machiavellism, psychopath. Psychopath means as like antisocial behavior, like criminals, rapists, juvenile home people. All these had low empathy. Why? Because inborn trait they had developmental disorders and personal. These people had very low empathy and compassion. That we should also keep it in mind. These kind of people we should never expect uh, empathy and compassion in these people. But see, empathy and compassion is a not inborn trait. We can develop this empathy and compassion by doing exercise. Like we are going to exercise daily to go to gym. Why we are doing to build a muscle, right? Like this, through exercises, mental exercises, we can build empathy and compassion. This is not an inborn trait. We can learn it. That is the thing. See how if we respond a person with empathy and compassion, he or she won't forget you in life. A small act of kindness make a very big difference in their life. What does compassion do? Compassion may boost your well being and reduce the depression. It protects against stress. Majority of people, they need other people how I'm feeling. Like it's a compassion is an we should put ourselves in other shoes, right? It reduces stress. If example, if a if marital people are there too, if husband uh, move towards his wife with empathy and compassion, he can reduce her stress by sharing the work area or kitchen area. Second, the balance the work. If if a woman only want to do all this means again it creates stress and friction. It leads to some other conditions and it leads to disturbance in their family. And it increases the willingness and trusting you loyal. If someone is sharing with you, that means we have to trust. It increases the trust and loyal to the person. Nowadays all we are lacking, we are listening that no one is loyal, so I don't want to share everything. That's why people are coming to counselors or psychologists or clinical psychologists. They don't have a person to listen. Without everyone is going to judge you, they think they thought, "Oh, I don't want to share this person, they will tell to someone." So they keep hiding this self and they keep everything at the bottom of their heart, and one day they will burst and they will commit suicide. Share, please share what are you're feeling. So all need to develop the habit of empathy and compassion right from the childhood. We should teach your child, inculcate this habit from the right the childhood so he can learn. It's like, as I told you, it's an exercises you have to inculcate. You should teach how it affects. You should. There is a one extraordinary video in YouTube, Mr. Brown. If time permits, I will play that video. It shows how the person will respond with empathy and compassion, sympathy. It's a beautiful animated video. I will play it if time permits me. Next, how can I help them about suicidal feelings? How we can help? As I told you, active listening and few genuine words of concern and understanding create a major impact or a big difference in the person's life. How can we do active listening? Seeing the face of the speaker, we should sit in front of the speaker. It should be not too close or not too far. Open body posture. Like see someone hold hands like this. Okay, that is closed body posture. There is a book called How to Read a Person Like a Book. You can go through that manual. We should not close like this. When you are listening to other person means we should open a body posture like this. Open your hands or widen your legs. Don't overlap your uh, feet. Everything. Lean straight forward. Like example, I'm showing you. If someone is sharing, if you go back means does it show any interest to create that interest? No. You should lean forward and show interest. That means eagerness to hear more. I'm ready to hear. I'm willing to hear. Please talk about it. I'm here. I'm here to listen about. Please share like this. Eye contact. Maintain a constant eye contact. Like this, we have to maintain a decent eye contact. Refrain from physical strain. It can escalate distress. A physical contact. Sometimes a person is explaining this, we can pat their back. Okay, that doesn't mean you should hold him like this or tightly or like that. It can cause distress. Maybe this person is not showing interest to touch like this. Already they are in some pain. They are going under something. Should not make them feel distress. Okay, maintain a respectful distance. As I told you, maintain a respect. It should not be too close or too. Sometimes in some suicidal persons, we are continuously bombarding, asking questions. Hey, tell me what you did. Tell you. Sometimes uh, who committed suicide or willing to do suicide, they became very depressive and low mood. We're continuously bombarding, pressuring them. "Oh, tell me. They will hit you whatever besides just. Please be aware of that. So maintain a respectful distance. Ensure individual feel safe and supported. The main motto here is the person, we should save the person and make them to feel safe and supported. Undivided concentration. Like when you are with someone, you should maintain concentration. You should maintain good concentration. If you're talking, you are listening with someone in between, oh, please don't give that, don't give, can you switch on the light? We should not show, these are the don'ts we should not do. Please maintain concentration and mindfulness. That is a very, very important. Don't focus on the response. Hey, what hello, what he's telling, I need his response. Don't focus on the response. Just listen the person. Use affirmative sounds. Like when you, what, how other person knows you are listening. Like, huh, I know, yes. Like these are the positive, some affirmations. Huh, like that. Don't use too much. Use ask open-ended questions. This is the main thing we have to ask. Have you have been feeling? What happened next? If some come, how you, like beginning of the session, we ask how you been. Would you, may I know what do you want to talk? Like this, we should never ask why, what, where. Okay, would you like to explain me? May I know? If you are okay, like that, what happened next? If someone says that yes, I committed suicide, then we should ask what happened next. What are the coping mechanism you and your family do? Avoid why questions. Why you did this? Please avoid this. Why you did this? You don't have shame while committing suicide? No, should never ask this. Pause or silence, give them time. Sometimes they are explaining the things. Don't be in a rush. Give them time. Suddenly the person becomes silent. They recall the thing and they feel bad about it. Please give them a time. No need to rush. If you only have time, be as for a listener, the main thing is you should have patience and kindness. Patience. You have to sit and listen with very patient. Okay. Pause or silence, give them time and give them space. Sometimes they need water. They feel that there is a lump in their throat. Please offer them a glass of water and pause it, and then only after some time, are you sure do you want to continue? Main, or are you sure, like that we can ask. So these are the concerns. Using a non-verbal clues like mirroring their body. Now, how you're listening, how get the other person knows you're listening. Giving a non-verbal clues like nodding the head, showing the interest and leaning forward. These are the non-verbal clues. Be a non-judgmental person. This is a key point of thing. Be a non-judgmental person. Treat the person with respect and dignity. Everyone deserves respect and dignity, irrespective of their gender, race, creed, caste, everything. Everyone in this, everyone deserve this thing. Avoid evaluative comments. Please avoid. Evaluate. Oh, you failed. That's why you commit suicide. Don't evaluate. Don't evaluate. Here not. We are validating someone' opinion, validating their life. Here we should not validate and evaluate their comments. Don't be sarcastic. Hey, that's why you did, huh? Oh, don't. You should not do that like that. Don't be sarcastic. Don't crack jokes on someone's sadness or pity. Okay, don't get over involved. If someone is saying that, oh, madam, I did this, don't get over involved. If you get over involved, means you get distracted from that and overprotective. Maintain neutral facial expression. That is the important thing. If the person is explaining their things, if he is saying these things, this, you should don't change of, oh, is it? Why? When? No, you should be calm. If we express like that, the person feel like, oh, something happened to me. Maybe that might be small, and we are magnifying that thing. Maintain a neutral facial expressions. Acknowledge their own biases. Acknowledge their own biases. Let them. Confidentiality. Confidentiality is key. Why someone is not able to share their problem? My first main thing is not. with judgment. People used to judge, and confidentiality is not meant. If someone, example, it's in corporate setup, someone says something to someone, he said, "Okay, we will keep it as a confidential." Later, he will reveal to everyone. That person say, "Ayyo, why I reveal to this person? Maybe he's not right person." So everyone is laughing at me. Again, create a big mess. It might lead to depression too. And he won't how is not able to face all these people. Not everyone will think like, but someone. Don't skirt around the topic. Someone that a problem is there, we try to hide the problem under the skirt. Example, if the problem is there, we thought, oh, nothing. It doesn't happen. It's a small one only. Don't skirt. If a problem is there, try to explain them to this is happened. You need referral. This small thing like this we should not. We should we should be very clear about it. Stay calm. The entire the session when someone is explaining, please stay calm and patient. What are the don'ts we should not do? As I told you, please don't pressure someone to tell their story. Come on, Chalo, tell me what you gone through. Please give them some time. If the person, as I told you, it takes some time to adapt the person to tell us. It is not easily to trust someone. Okay, make them in comfort zone, feel them in safe zone and comfort zone, and ask them in polite manner. Don't pressure someone to tell their story. Don't interrupt or rush someone's story. As I told you, beginning of the session, we should allot some time. We should have a lot of patience. Don't interrupt in middle of I had some work. Please, tell me fast. We should not do that. How you feel? If you're in same in that place, how you feel? Yo, this person doesn't listen me. They will close. They will close themselves like they keep their face beneath the shell like the tortoise. They won't open themselves. Don't give simple and unrealistic examples. Hey, come on, this is a common suicide. These teenagers, now they will do nowadays. They are all committing suicide. Don't give simple, unrealistic examples. Don't generalize. Each and every have and had their own problem. Okay, each and everyone. Don't make this simple and unrealistic. Oh, do this, this happen. Do this at night. You at night time you can do this. Tomorrow, next day onwards, your suicidal thoughts vanish away. Don't give a real unrealistic example. If a person commits suicide, he needs psychiatric counseling. If it's level 3 and level 4, you should go for counseling psychologist, a psychiatrist. He needs a medication. It's not a magic. It happens someday. Don't make up things that you don't know. Sometimes, if similar person is committed suicide, oh, this one committed suicide. This thing happened. Maybe it might be happen to you. No, do not make up things. Don't use any technical terms. See, all people doesn't have any no, these don't know about these technical terms like narcissistic personality, behavioral issue like that. So don't use any technical terms. Don't talk about your own troubles. If something there is explaining, mean in middle and you interrupt them, hey, it also happened to me, once upon a time it also happened to me, how I faced it. No, should not talk about your own problems. Don't criticize them. Don't you did this, that's why you are here. This is happened. Don't criticize them. Already they are in such a big pain. Okay, don't criticize them. What are the tips to become more empathic and compassionate? How? Listen more than you speak. We have 2 years to listen. That's why God gifted to us. Listen more, speak one. We have one mouth, right? Don't be afraid to showing vulnerability. Show that the I am here to listen you. Show your vulnerability so that people can come close to you and explain what they are going through. If they need help or seek help, you can. Don't make assumptions. Okay. In mind, if someone is explaining their problem or their concern, something in their mind, don't, oh, He committed suicide means he committed suicide. Why? Because he had love failure. Maybe that girl cheated him. Maybe he cheated him. Don't make assumptions. Pre-assumptions or assumptions, that's very dangerous. And we are coming to the end of this session. We are all different. Don't judge, understand instead. You can only understand people if you feel them in yourself. I'm again repeating this. We are all different. Don't judge. Understand instead. We can only understand people if you feel them in yourself. Thanking you. Thanking you, everybody.